Well, hello, Virginia Conference. I have the wonderful pleasure today to have a conversation with Dr. George Moxley. Dr. Moxley is a member of Virginia United Methodist Church in the Richmond District, and I am also blessed when I asked Dr. Moxley to be a part of the In-person Worship team. He is one of our medical professionals that's giving us advice and wisdom. So Dr. Moxley, I just want to say thank you for having this conversation with me today. Why is it important for us to wear a mask?
The reason that we wear masks is to protect each other.
Yes.
Now, the thing that you have to keep in mind is there are a number of measures. I'm sure that many people have heard about these. There's the physical distancing you mentioned. There's also the masks, wearing masks. There's avoiding crowds, staying home a lot.
Yes.
And then hand washing. And the reason we do all of those is that each one is imperfect. So we stack one defensive measure on top of another. If the virus gets through one defense, then the second defense you would expect would take care of most of it.
Okay.
So that's the reason. We do all these things together to take care of each other.
As we say, we not only wear the mask for ourselves, but I also wear this mask to protect my brother and my sister in Christ. Can you talk a little bit about that?
Oh, sure. The risk of a serious or life-threatening disease is significant.
Yes.
This COVID-19, the virus that causes it is, there's very few people are immune. It's a new virus.
Yes.
There's no cure, there's no vaccine at this point, and it's very infectious, and it kills people about 10 times as often as influenza. So it is dangerous. It is really dangerous. There will be many, many deaths. Already we have 147,000 deaths in this country. Vietnam War was 58,000 soldiers killed or missing. During the early years when I was a physician, was the AIDS epidemic, 48,000. We're already 3 times that with this, and we're not done yet. This is a very serious infection, and many, many people could die from this. The estimates were in the millions that could have died from this if we hadn't done anything.
Many people say this is a hoax.
It is not a hoax.
How do you answer that question?
Well, we did not think this was a hoax. This is a very serious illness. We closed our hospital, except for COVID-19 and other very serious things. We even cleared out a student dormitory that had been a hospital, and cleared it out and got it ready in case we needed it. This was very serious. In the spring, it was nearly the #1 cause of death, this COVID-19. It was right up there with cardiovascular disease. Our department chair warned our division chair to set up a succession order, and the implication of that is, this is so serious you may die from it.
Yes, yes.